Hi, my name is Zixin Gu. Today I will discuss the project of the automated assessment of overnight oximetry in children so that you can understand its importance, also how it contributes to the innovation of both engineering and medicine fields. Pediatric obstructive sleep apnea is a sleep disorder in which the child's breathing is partially or completely blocked over and over again during sleep. As you can see in figure 1 below, this condition is due to narrowing or obstruction of the upper airway during sleep. It is a disease affecting 1% to 5% of children around the world and currently requires overnight polysomnography for diagnosis. But unfortunately, pediatric sleep laboratories around the world are relatively unavailable, and PSG is a way that costs a lot and labor-intensive, which further limits increase in access and lead to the longer waiting time. Overnight pulse oximetry is another method which is simple and effective due to its low cost and easy availability. As an index to measure the amount of oxygenated blood, the saturation of arterial oxygen is an important physiological parameter to reflect the function of respiration and circulation. Now in Australia, using the McGill scoring system, pulse oximetry has been used as an alternative diagnostic tool for childhood OSA. The McGill scoring system has been widely used in hospital and related research. It is the most used analysis method in healthy children with OSA. Look at this table here. It shows that the increase in the score is strongly related with the increased severity of OSA. However, this requires manual scoring by the experienced physicians trained in the sleep medicine. This project aims to develop a computer algorithm that has the ability to automatically analyze the overnight oximetry data based on the standard McGill criteria used by the Royal Children's Hospital and report the diagnostic results. It will lead to more timely treatment of the pediatric patients and may improve the clinical outcomes. So first of all, I chose MATLAB as a programming language. And next step is to build a decision tree based on the standard McGill criteria. The two definitions needs to be explained first. The first one is saturation. It was defined as a decrease in blood oxygen saturation of at least 4%, and a cluster was defined as a series of 5 or more desaturations that occurred within 10 to 30 minutes. There are two variables that are used to identify the desaturation. So the first one is called the minima. It's a negative peak found by the algorithm. So it's either less than the two adjacent samples or equal to the negative infinitive. The second variable is a baseline. It's a basis for finding the average value of the data near each minima. It is the local maximum before the minimum we are looking at. Once the minima and its baseline is identified, subtracting the baseline by the minima and get a 4 value. Compare the 4 with 4%. If it's larger and equal to 4, then the minima should be defined as desaturation. In the part of identifying the desaturation cluster, take the 10-minute block after the minima you are looking at and count the number of desaturations in the block. If there are at least 5, then it is a cluster. Otherwise, go to extend the block to 30 minutes and count the desaturations number again. If it is already 5 or larger than 5, it is a cluster. Otherwise, skip the 30 minutes block and find the next minima and look at the 10-minute block after it. I also completed the graphical user interface of the application. It will display the figures of SpO2 over time and heart rate over time. The classification result will be shown in the left part, and all the details for analysis will be displayed in the text box below the figures. There is a check button that can review all the raw data in another window. The Save button is used to report in a Word document. In conclusion, together with our efforts, we finished the compilation of the automatic scoring program used for the pediatric OSA diagnosis. which is highly consistent with the conclusions drawn by the trained professionals. The automatic scoring algorithm developed in this project will save doctors valuable time and enable the pulse oximetry testing to be used in more non-tertiary pediatric health centers around the world.